Good morning. We are thrilled to see you here on Facebook. Welcome to the program Virginia Interfaith Center Live. This is the Virginia Interfaith Center for Public Policy's weekly news program addressing issues of economic, social, racial, and environmental justice here in Virginia. Especially during this COVID-19 crisis, we are pleased to be able to bring you reports from legislators, faith leaders, community leaders, students, workers, and people who are advocating justice in Virginia. We're going to offer resources where you can learn about the issues, learn how to protect your family, and we're going to keep our legislators accountable. So today, we are very excited to have some special guests. We have, and I'm going to reintroduce everyone at 11 as well, but we have Kim Bobo, Executive Director of the Virginia Interfaith Center. Welcome, Kim.
Thank you. Good to be with you.
And we have Senator Barbara Favola, Democrat from the 31st District. Welcome, Senator Favola.
Thank you, Roberta. Delighted to join you.
And Josh Briere. Josh, tell us
Roberta.
a little bit about yourself, please.
Yeah, thank you for having me on here. And I am a restaurant worker here in the Richmond area. I've been working in the restaurant industry for almost 6 years now, since I graduated high school.
Well, we are thrilled to have you. And we are thrilled also that we want to have our viewers logged in on Facebook and writing questions. Journalists, policy advocates, all of you, we want to hear from you. And we will be listening to your questions. I will be presenting them to our guests, and you will have an opportunity to interact and get answers, especially at this difficult time. It's very hard to get a pulse on what's going on. So much information is coming at us from all areas. And so the Virginia Interfaith Center brings you a voice of the faith community, and we are very happy to be able to do that. And at 11 o'clock, in about 5 seconds, we're going to start again and come in live. And hello, everyone. Welcome to the Virginia Interfaith Center Live. This is our weekly broadcast bringing you issues about economic, social, racial, and environmental justice issues here in Virginia. Today, we're going to talk about paid sick days. And I'm very happy to introduce you to our special guests. We have Senator Barbara Favola. Thank you for being here, Senator.
Thank you, Roberta.
Josh Briere. Welcome, Josh.
Thank you, Roberta.
And we have Kim Bobo, Executive Director of the Virginia Interfaith Center. So, Kim, could you start us off and give us the background of why paid sick days? Why is this such an important issue?
Well, for the Virginia Interfaith Center for Public Policy, we're always concerned about particularly low-wage workers and families, and where are the places that we might be able to make a difference in terms of public policy, in terms of raising standards and pay for families that are struggling. And so one of the places we realized that was a huge problem in Virginia is that 41% of private sector workers, so 1.2 million workers in Virginia had no paid time off, no sick days, nothing. It's not like they had vacation, didn't have sick days. They had nothing, no PTO whatsoever. And particularly for low wage earners and their families, this is a huge crisis. If they get sick, they then had to make the choice, well, do I feed my family, or I go to work sick? Or if they have a child who's sick, do I take the day off and care for the child, or do I send the child to school sick? And in fact, teachers, particularly in low-income communities, told us they always have sick kids in school because parents have few choices. And so they send kids to school sick so they can earn money so they can feed them. So we've got families with having to make these terrible choices, and we just felt like we needed to do something about it. And so we knew that 13 other states around the country had passed some standard on paid sick days, and it just felt like something we should do here in Virginia. And so,
How did you connect with Senator Favola?
Well, honestly, I'd been watching her. She may not know this, but I had been watching her for years. And the things that I really liked about her were, one, she was always prepared. Like, she knew her issues. And honestly, that's not always the case with all legislators. So whenever she got up to testify, she was always prepared. Secondly, she carried issues like this. She did things for families and kids, and so this was in her wheelhouse of the kind of things that she did. And thirdly, she worked across the aisle, right? She worked in a bipartisan way, very pragmatic, trying to get things done. And so, honestly, she was our first choice of legislators. And so I remember the day going to her house and saying, would you consider being the patron for us on this bill? And she just was like, well, yes, of course we should do this. Let's figure out how to do it. And again, I don't know how we could have gotten a better champion than Senator Favola in the Senate, right? The Senate is, honestly, for a lot of the things we care about, there's still a bit of a challenge. And so she's been a fabulous patron. So I'll let you talk about it from your side, Senator, but that's from our side why we were so honored to have you be the patron on this.
Oh my gosh! Well, thank you, Kim. It was really a pleasure and a privilege to be the patron on this bill. Paid sick days is one of those issues that is critically important to our working families and to the health of our communities, and certainly to the health of our children. And it's one of those safety net issues that should be part of the expectation when people work. People work to provide a certain quality of life for their families. People work to ensure the health and safety of their loved ones. People work to contribute to society. And they want to be good citizens, and they want to be good parents, and they want to do the right thing. And when we provide a workforce requirement such as paid sick days, it enables workers to do the right thing. If they're sick, they can take time off, go to a doctor, get the medication they need, take care of themselves, and then go back to work in a way that when they're non-contagious and get paid because they did take time off, but they can continue to earn a living and take care of their families and do the right thing. Our bill also allowed workers to use paid sick time to care for a child, a family member who is living in the household, a parent. And that's the kind of safety net we need to reinforce. The issue in government is always who should be providing the safety net. Should it be the government? Should it be the private sector? Should we put the entire burden on individuals? And right now, we are asking for corporate responsibility, and we're asking for personal responsibility in this paid sick day bill. I thought it was very reasonable, and it was modeled on national data showing us that, in fact, many children go to school sick because their parents can't take time off to take them to the doctors, and those same children are often behind in their vaccination schedules. So there's that piece. We also know that folks who are serving us in close proximity are less likely to have paid sick days, which then becomes a public health matter. The personal care workers, the restaurant workers, the assistant in the child care center. Those folks don't have paid time off. So that's a problem. That becomes everybody's problem. So we thought this was reasonable. It was if you worked full time, 40 hours a week, you were capped at earning 5 days a year of paid time off or paid sick time. And then if you worked part-time, we allowed for, the bill allowed for you to earn paid sick leave. You earned 1 hour for every 30 hours worked. Again, that was capped based on the number of hours you worked. And the cap would never exceed 5 days a year. And so that seemed very reasonable to us.
So we have the great pleasure of, thank you for explaining that. And I want to give a chance to hear from somebody on the front lines. We have a restaurant worker here, Josh Briere, who is directly impacted by this. Could you speak to what Senator Favola is addressing, Josh?
Yeah, absolutely. And, first of all, I just want to say thank you, Senator Favola, for the bill. We really appreciate people in government advocating for folks like us. And then, of course, to everyone at the Interfaith Center, we really also appreciate all the other work y'all are doing as well to advocate for, people in our situation. But, from my perspective and the perspective of folks I work with, paid sick days are important because every single day, all over the country, you have millions of people going to work sick, and that becomes a public health crisis. And that very well could have been a big component to the current crisis we're in right now. And you can't really blame workers for it because they don't really have a choice. If the choice is going to work sick so I can feed my family or avoid being evicted or not going to work, I mean, clearly the obvious choice is to go to work sick. But it shouldn't be that way. We need the government to step in and to say, hey, look, here are 5 paid sick days a year that you get, and you can use them to take care of your child, to take care of yourself, whatever, that protects the worker and it protects public health.
So just a follow-up question, Josh. I know you said you've worked for 6 years in the restaurant business part-time. Have you ever had paid sick days?
No, I never have. The whole time, and I've worked for several restaurants. Where I work currently, they're a lot more understanding about it. It's a locally owned restaurant. But so like if I call out or whatever, they're cool with it. They're totally understanding. We'll get someone to cover the shift. But even so, there's no paid sick days. However, at the other restaurants I've worked at, particularly chain restaurants, there's just almost no understanding at all, and when I was in a leadership role, it was even worse, If you were throwing up, go to the bathroom. If you had a fever, just don't act like it,
Wow.
And so could people get fired if they, were sick and took a day off, even if it was unpaid, Josh?
Like I said, currently at my current restaurant, no, that would never happen. But in other restaurants, I'm afraid to say that, yeah, I think that would happen. Luckily, I was never in that position. But I don't think it's a stretch to imagine that.
Yeah, that's what I've heard, that a lot of restaurant workers they're not even allowed to call in sick for fear that they would get fired.
Right. The repercussions are real.
I think that, allowing that kind of workforce policy is just so short-sighted. I think it's short-sighted for the employer. I think it's an incredible scare tactic and burden for the employee, and then the rest of us are subjected to a situation where germs can spread and we can all get sick. And I just want to pivot, I guess, at this point, since we're talking about workers going to work sick. COVID-19 really does present in true colors, in full fashion, where everybody understands the importance of staying home when you are sick. I mean, right now under COVID-19, Governor Northam has a stay-at-home order, which is in effect until June 10th, asking non-essential workers to stay home, only go out if absolutely necessary to purchase groceries or to do another emergency-related kind of activity, to keep your social distance, which is 6 feet, and to wear a mask, which is also a CDC best practice. So for workers to be able to follow those rules and not fall through the cracks and become homeless, we have to have some mechanism to for paid sick leave. We have to. I mean, in this case, we all have to follow the rules, whether we are, carrying the COVID ID germ or not, because it is so wildly contagious. And the federal government stepped in and said, okay, we're going to have to provide some unemployment insurance for folks who cannot telecommute. We're going to have to provide a safety net for folks who may have to lay workers off, the PPP program, the Paycheck Protection Program for small businesses, to allow small businesses to continue to keep employees on the payroll. Unemployment insurance has been stepped up. The federal CARES Act will allow for $600 a week for unemployment insurance in addition to state unemployment insurance. So I don't mean to take up the whole program on COVID-19, but the point is that the federal government really realized that a safety net was needed. And most importantly, they have included paid sick leave in their federal package. So for an individual who has COVID-19, they get 2 weeks of paid sick leave and then an additional week, to fully recover. And I think that's an acknowledgement that employers have to provide this. Maybe we need to give incentives to employers. Maybe we need to provide other public subsidies, but this has to be done.
Senator Favola, we have a relevant question from one of our listeners. Don't businesses benefit as well when they offer paid sick days? Kim, who would like to address that one?
Yeah, of course they do. Because one, you have a much more loyal workforce. Secondly, you don't get your other workers sick. In fact, when folks at my office say, "Oh, I'm not feeling well, but I'm going to come in," I'm like, "Please don't come in, right? Don't share that." And so you overall will have a much healthier workforce, and particularly for the restaurant industry, if they have workers come in sick and potentially get some of their customers sick. And in fact, the CDC has said long before COVID-19 that coronaviruses, half of them are spread by food service workers, right? So we know that they spread these viruses. If your restaurant or your business is known and shown to have done this, you could have a huge liability. And so it's really important for businesses to not shirk on the short term and think about the long term and provide paid sick days.
Then can you explain in a nutshell why on earth this bill did not pass in Virginia?
Barbara, Senator Favola, you want to start on that one?
I'll start on it. You can add in too, because you are a wonderful advocate and have done yeoman's work getting the bill as far as it did. The bill went through many hoops, passed the Senate, passed the House. We had a conference report to pass the House the second time and then came to the Senate and did not pass. There was a lot of fear, I guess, and I think lawmakers, whenever you try to make a transformational change, which is what this bill is, it's really changing the way we do business, and it was transformational. Folks always think of the worst possible impact the bill could have. Oh, would it cost so much an employer couldn't handle it? Or, how would an employer implement this in an easy way? And would they have to change all their policies? Well, the fact of the matter is they will have to adopt policies if they don't have a paid time off policy. This bill only applied to businesses with 15 employees or more that did not have any paid time off policy. So many responsible businesses would not have been affected by this at all.
So what I'm interrupting is one of our listeners has a direct response question to that. Why the pushback from the General Assembly? I suspect the pro-business lobby was super strong. Was the faith and values advocacy just not enough? You want that one, Kim?
Yeah, I think our advocacy was not quite enough. I think what Senator Favola is saying is absolutely right, that there were some forces out there that were just raising all these unbelievable fears, like, this is going to close down small businesses in Virginia. Well, that's not the case. This would be so terribly complicated to administer. Really? No, I don't think so. And then there were really people that had sort of an ideological view that we really shouldn't set such standards as this, right? That we should allow the private sector to operate completely on its own with no standards. And I think as a nation, going back to 1938, where we enacted child labor laws and a minimum wage law, we have said, in fact, there are some standards. And we at the Virginia Interfaith Center, I think, are saying, that child labor laws are important, minimum wage is important, but frankly, right now we need a few other core standards, and one of those core standards we need is paid sick days. And so, in fact, there was enormous opposition for the bill in ways that to me didn't make sense, because there really are lots of good small businesses that are providing paid sick days and other benefits. But again, the National Federation of Independent Businesses were just out there like saying the sky is going to fall on this one. We had the Restaurant Association, where 81% of their workers don't have paid sick days, absolutely saying we can't possibly handle this. Retail Federation doing the same. We even had a couple of the airlines trying to exempt their workers, like, this is too complicated and it'll mess us up. We're a national company. We should be exempt. It's just, it was quite crazy. Actually, and then at the last minute, we had the Manufacturing Association, whom probably most of them provide paid sick days. We had in one of the Senate hearings at the Commerce and Labor Committee, we had the poultry industry saying why they didn't need paid sick days. And now, during COVID-19, we're seeing the crisis of all these poultry plants in Virginia and the giant Smithfield plants and the big plant out in South Dakota, where they have such a problem with the virus, frankly, because they probably weren't offering paid sick days. I think the business community just whipped themselves up in a frenzy in a way that I'm hoping we can do a better job sort of calming them down, because there are great businesses in Virginia who want to do the right thing. But the advocacy against this was pretty virulent.
It was. And I think we have to make the argument, and we need to get businesses to make the argument with us, that a mandate really levels the playing field. So no business then is disadvantaged financially by providing paid sick days.
That's right.
We should, the good guys should step up and stand with us and say, you know what? We should all be doing this. This mandate is simply the right thing to do, and it is good for business.
Yes.
We should be able to embrace that. We have got to get away from this argument, and many of them had very flimsy arguments that we're just opposed to any mandate. Let businesses run their own business. We're opposed to any mandate. That is not the world we live in right now, and nor should it be. We have to promote some type of good public health, some leverage for workers who may not be able to access equal benefits or equal treatment in the workplace. We have an obligation to stand up for those folks and for our communities who need to be healthy. We need to be healthier.
I think what's interesting is that in the midst of this COVID-19 crisis, the federal government has stepped in and created a program that, frankly, is what we probably needed in the first place.
More generous than our program.
Absolutely. It's way more generous than our Virginia bill. So our Virginia bill proposed 40 hours for businesses that had 15 or more employees. The federal one is 80 hours, so twice as much. We had a struggle. Our bill covered part-time and full-time workers, but we had some senators who thought part-time workers didn't need any paid time off. The federal bill is very clear. It covers both full-time and part-time workers. The federal bill, in addition to this, your full pay for 80 hours, it then also allows you to take a longer term leave at 2/3 of your salary. Again, we didn't even have that. Now, Senator Boysko had a bill that would have done some of that, but that was not at all in this bill. So again, the federal response in this crisis is actually probably closer to what we need as a society. And yet the federal bill ends at the end of December. And so when we come back in January, we need to try to continue to make the argument for this. And again, if it's needed in a crisis like COVID-19, it's probably needed on a regular basis. And I think that's what we've got to fight for in Virginia.
And Josh, could you talk about this from the workers' point of view now that we've heard the policy analysis?
Yeah, I mean, I think to Kim's point, something that I've been paying attention to is that all of these progressive policies that for years and years people have said aren't realistic or we just can't do because it's bad for business or whatever, all of a sudden in a crisis, the federal government is stepping in and doing these things, which proves that they're not as impossible as we've been led to believe all of this time. So I think that a lot of workers are paying attention right now. I'm part of this restaurant worker group on Facebook in the Richmond area. And, you know, just the conversations there are all leaning in that direction. Like, well, if they're saying that we can't get extra unemployment insurance normally, but all of a sudden now we're getting 600 extra a week, why can't it always be like that? You know?
That's right. I did have one of the commenters, the live commenters, reminded me that this paid sick day bill at the federal level really is only for COVID-19. It's not for other sicknesses. And obviously our bill in Virginia was not just for coronaviruses. It was for a range, you know, whatever your sick issue is.
Yeah.
Right. And one other thing that I'm going to add real quick is that for essential workers like grocery store cashiers or childcare workers or, you know, restaurant workers like myself, who, you know, there are still these needs that have to be met, whether we're in a crisis or not. Right now, I'm still having to go to work, even though my hours have been cut and my pay has been decreased a little bit. I'm still working, and there is, even though I'm wearing a mask, there is still a little bit of interaction with people for curbside pickup and whatnot at the restaurant. So we are all risking our health by going out to do this. And it's, you know, it's kind of scary to think that when this is all over, there won't be a paid sick day standard to protect us when our coworkers are sick or when other people are sick, you know?
I would like to add that many scientists are telling us that we will not be completely safe from COVID-19 until we have a vaccine. And we may be able to go into a second phase as we, you know, attempt a more normal life, but we're going to continue to have to do social distancing and keep our, you know, clusters of groups quite small for some time. And many scientists believe we're not going to have a vaccine truly tested and on the market until late January 2021. So we can't have a gap. I mean, having the federal protection only through December of 2020 is simply not enough. So I don't know if the feds are going to pick up and take it another year, but regardless, we have to have a state model as well. And I think maybe, Kim, I think we need to start making the argument that now is the time for lawmakers in 2021 to shape a Virginia response. Otherwise, we could be under, you know, a federal program that some businesses might not find as desirable, as palatable.
And
No,
Kim,
that's right.
Yeah,
Go ahead.
can you address this question from Kendall Crawford? I think goes right to the heart of what the senator's talking about for next year.
What are the chances of getting paid sick days? I think, Kendall, thank you for the question. Appreciate you watching this. I sincerely believe that the discussion on paid sick days next year is going to evolve around where we are with the COVID-19 crisis and where the federal government is leading the paid sick day conversation. And we'll have to figure out what our space should be and how we should maybe follow the federal government or how we should tweak it to fit Virginia. But I am very hopeful that this new context that we're living under will bring businesses to the table. And I think maybe, Kim, maybe we've got more of an entree to the business community now than we had last year.
I think that's right. And I don't think there's everyone in the General Assembly knew about the issue by the end of the session, right? It had become a highly talked about issue. So I think people know that the issue, and not one single business representative that I talked to tried to make the case that we didn't need paid sick days, right? So I think people understand the value of paid sick days. They're just, again, we're all these fear kind of things. And so, again, we've got to figure those out, and we've got to get the business community talking about this. And, that in fact, this isn't going to be too complicated, and it really won't kill small businesses to offer this. And it really is good for your business. And so, again, we need to do a better case of making that argument. But again, I don't think we were short a few votes in the Senate, right? And so, we've got a few senators that we need to have conversations with, and some ideologically wondered whether part-time workers needed it. And so we've got to have some conversations with people about, the value to part-time workers as well as full-time workers, or people with part-time jobs, because in fact, as lots of people have told me, I work multiple part-time jobs.
So if they don't get paid sick days at least one of those jobs, then they still don't have any paid sick time.
That's right.
We can send Josh to go talk to them, Josh.
Yeah.
I'm sorry, say that again?
We can send you to go talk to those senators.
There you go. Well,
But
what I
again,
would tell
there
them
are
is
plenty
that-
of people in their districts who have this same problem. And so, again, I do think we've got some educational work to do with some of the senators, but also, again, as Senator Favola has said, we've got to draw on the business community and engage them in this conversation. And Senator Favola has a history of having done that kind of thing on other bills. And so we are looking forward to doing that.
We are not going to quit. And we're also going to bring in more of the public health folks this year.
Yes.
And, because there are a lot of voices that didn't get heard. The conversation, is once you get to the General Assembly, the conversation is not as, it's very fluid. It's not as contained or comprehensive as you would like. It's not as comprehensive as you would like. So
they are, just let me be clear, the legislators are crazy busy. They can barely think about anything. Like, it's amazing how hard you guys work.
It is amazing. And I wanted to share on behalf of the Interfaith Center, this is the 1-877 number that all Virginians can call for the Department of Health for any information about the coronavirus, but also about paid sick days and how that impacts you. I'm going to ask us to wrap up because our time is running short. And I'd like to ask each of you if you want to have a last thought for us to walk away with. And I want to also thank our viewers. We have had wonderful questions. We haven't had a chance to answer all of them, but we greatly appreciate your watching. We hope you will continue to watch. You will share this with your friends and send us suggestions for issues you would like us to address. Maybe we could start with Kim. Would you like to wrap it up, Kim?
Yes. Well, again, we need your help to make this happen in Virginia. So if you're not already involved and connect with the Virginia Interfaith Center for Public Policy, I hope you'll go to our website and sign up to get our action alerts and join one of our chapters around the state. And again, we want to make this happen, but we can only do it with your support and help.
Thank you, Kim. Senator?
Well, I just want to echo Kim's remarks. We need a lot of firepower behind us to get something that this transformational, to get something like this through, and we need as many friends as possible. So for those of you who do have, you know, connections to groups that may not naturally align with us, that would be helpful. You know, again, the business community, the public health community, and you know, folks that just want to do the right thing because it is the right thing to do, I think could be, you know, could be very powerful voices. We need personal stories. And I'd like us to follow the same model we did to get Medicaid expansion through. And we did get support from chambers of commerce on Medicaid expansion.
Right.
So, so there's a model there that we can draw on.
Thank you. Josh.
Yeah, thank you guys again for having me. And I think I would just, I think my final thoughts are that there's a big moral argument here. And that, you know, at the end of the day, every worker all over the country, whether you're, you know, a restaurant worker or any other kind of worker, at the end of the day, we're all human beings and, you know, we all deserve dignity and respect. So I think our state and our country both need to enact legislation that embody, you know, the respect of human life and humankind, much like Senator Favola's bill. You know, because everybody deserves a day off of work when they're sick without having to worry about where, you know, their food is coming from or if they're going to be able to get their food or pay.
Thank you, Josh. I just want to close out by sharing, you know, when Josh mentioned the moral issue, the Virginia Interfaith Center for Public Policy does bring a faith voice, a moral voice, a voice of justice to these issues. Even if you're not a member of a faith community or affiliated with a mosque, church, synagogue, or temple, all people of goodwill are welcome to join us and be a part of this movement to be a voice, as Josh said, for all of us. Everyone deserves to live in dignity. And those are the kinds of issues. And I am thrilled to be able to partner with an incredible senator like Barbara Favola and an executive director as well, Kim, who has been working on these issues for many years. And partners like Josh and folks in our community who support this. So we really welcome all of you to this broadcast. We thank you. I thank you all for taking the time to join us. And this will be taped and it will be on our Facebook page and on our YouTube page and on the front page of our virginiainterfaithcenter.org. Sign up there, please, to receive our free emails with lots of information about what you can do to engage in these issues here in Virginia. So thank you all so much. We're going to sign off now.
Thank you.
And we'll see you. Oh, wait, one other important thing. My goodness. Tonight at 5 o'clock, we have another show on this topic in Spanish with Delegate Elizabeth Guzman. And we would like to encourage you, please. Here is our title in Spanish. All workers need paid sick days. 5 o'clock tonight on our Facebook page. Please join us. Please invite your friends. It's very important that these issues are addressed in many different languages. And so we will be doing this often in 2 languages. So thank you again, Kim. Thank you, Senator Favola. And we'll see you next week and tonight at 5.
Thank you. Great show. Thank you.
Thank you.